Bismillahirrahmanirrahim. In this lecture, we will discuss about common IV fluids, their name and uses, and their composition. Now, let's start it. What are IV fluids? IV fluids are specially formulated liquids that are injected into a vein to prevent or treat dehydration. तो आईवी फ्लूइड जो हैं ये मखसूस तरीके से बनाए गए ऐसे लिक्विड्स होते हैं जिनको वेन के अंदर इंजेक्ट किया जाता है ताकि पानी की कमी यानी डिहाइड्रेशन को के ट्रीट किया जा सके या प्रिवेंट किया जा सके इंट्रावीनस रिहाइड्रेशन इज अ सिंपल सेफ एंड कॉमन प्रोसीजर विद अ लो रिस्क ऑफ कॉम्प्लिकेशन तो इंट्रावीनस तरीके से जो पानी की कमी पूरी करनी होती है यानी रिहाइड्रेशन करना होता है ये बड़ा सिंपल कॉमन और सेफ तरीकाकार है और इसमें कॉम्प्लिकेशन का रिस्क भी बहुत कम होता है व्हाट आर द नेम्स ऑफ आईवी फ्लूइड्स दैट आर कॉमनली used. Number 1 is normal saline or NS. Number 2 is DNS, dextrose normal saline. Number 3 is dextrose solution. Number 4 is RL, ringer lactate. Number 5 is hemosil. Number 6 is mannitol. Number 7 is flavolite M. Number 8 is isolite. Number 9 is paracetamol. 10 is metronidazole and 11 is panamine G. तो नंबर 1 पे हमारे पास नॉर्मल सलाइन और NS. NS come into 500 ml or 1000 ml. The composition includes 0.9% sodium chloride and distilled water. What are the uses of normal saline? Normal saline is used in dehydration, in electrolyte imbalance, in hyponatremia, in wound washing, vehicle for injection. Normal saline should not be used in heart patient, kidney failure, pulmonary edema, aldosteronism. What is DNS or dextrose normal saline? Dextrose normal saline come into 500 ml or 1000 ml concentration. If we talk about the composition, it consists of 0.9% sodium chloride, distilled water, and dextrose anhydrous. If we talk about the uses of DNS, DNS is used in dehydration, in hypoglycemia, in hypotension, and in diarrhea. It also used in fluid maintenance. DNS should not be used in heart patient, kidney failure, pulmonary edema, diabetic patient, and allergic to corn products and hypertension patient. Next IV fluid is dextrose intravenous infusion. It comes into 5%, 10%, and 25% concentration. If we talk about composition of dextrose intravenous infusion, it consists of dextrose or D-glucose monohydrate. It also contains distilled water. We talk about the uses of dextrose. Dextrose should be used in dehydration, hypoglycemia, hypotension, diarrhea, and also used in fluid maintenance. Dextrose should not be used in heart patient, kidney failure, pulmonary edema, diabetic patient, and in patient that are allergic to corn products and in hypertension patient. Next IV fluid is ringer lactate solution. Ringer lactate solution is also known as sodium lactate solution. It comes into 500 ml or 1000 ml. If we talk about the composition of ringer lactate solution, it consists of sodium chloride, potassium chloride, sodium lactate, sodium hydroxide. Ringer lactate should be used in acute blood loss, shock, hypotension, diarrhea, and burn. Ringer lactate should not be used in liver failure patient, kidney failure patient, pulmonary edema, or severe metabolic acidosis condition, or in case of hypertension, we should not be used ringer lactate solution.